definitely I'm going to be studying further. I don't really want to jinx it, but I'm planning to study 2 things. I'm either going to go into Hey guys, welcome back to my channel. I hope you're all doing well. Thank you so much for joining me once again back onto my channel. My name is Belinda, and if you've not already subscribed, please don't forget to press the subscribe button as well as turn on the notification bell so you get a notification every time I upload. This is a nursing based channel, so all things nursing as well as other things included as well. So today I have got an update, a student nurse update. I've been asked quite a number of questions through both Instagram as well as on my YouTube, so I just thought I'm going to come together and gather those questions and do a student Q&A, an updated student Q&A. Okay, I don't think I've ever done any student Q&A before, but anyway, so this is basically an updated student Q&A of my current situation in regards to that. So I've got a few questions on my phone, so if I look down, basically, yeah, that's what I'm doing. I'm reading out the questions. Okay, so let's not waste any time and let's get right into it. So the first question that people want to ask, how am I coping with online lectures? Okay, so for me personally, I found it very hard. Now, when I say I found it very hard, it's because in my first year of nursing, it wasn't online. As I'm a final year nursing student, so obviously my lectures prior to that, everything we did was basically going to the lectures. We're having lectures in the classroom, so I understood the content more. I didn't feel like I was teaching myself, so it was a huge adjustment and a huge transitioning from obviously going to normal lectures to going online. And yeah, so basically that's the way it is. A bit different because obviously it requires a lot of self-discipline. I think it requires extra self-discipline because you have to get up, you have to get out of bed, you have to go and open the laptop or whatever and sit in front of it, blah 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 blah, when you know very well that you can actually just have a lie in, you know what I mean? So for me, I found it very hard to keep up with, and I'm not going to be sitting here and telling you guys that I've attended all my lectures, every lecture, because the truth of the matter is some days I wake up and I'm thinking, what for? You know, I just can't be asked. And normally with the lectures, obviously, I don't know how other universities work, but with my university, with the Montfort University, most of the lectures that they put online is pre-recorded, so you can go back and you can catch up later on, so you can do ahead of that. The only problem with that is obviously if you leave it for everything until late, you are piled up with quite a number of lectures that you have to get up to date with, so that could be a bit stressful. Okay, hopefully that one is answered. So the next question is, when are you starting your next placement? So I'm starting my next placement next week on the 1st of February. I'm starting in a cardiology ward. Yeah, that's what I'm starting my placement on the 1st of February. I'm going in for a long day. I've been given my rota, so yeah, that's basically what I've been doing. So yeah, that will be quite interesting. It is a 10-week placement. I'm fully aware of already obviously being a final year nursing student, or a third year, if you want to call it third year, finally, whatever, nursing student. There is a lot of higher expectations awaiting for us. Mainly, firstly, we're not going to be like directly supervised as we were in year 1 as well as year 2. It's going to be more of independent, able to do things independent. So I'm not going to sit here and say I'm not nervous. I'm a bit nervous because I don't know what is expected of me as to how independent I should be, but yeah, I'm looking forward to it. You know, I've heard other students obviously not being able to go on placements, and I think I'm actually quite lucky enough to go on placements, you know, able to get that learning experience prior to qualifying, obviously. And yeah, I'm happy with that. So yeah, like I said, I'm going on placements next week on the 1st of February, starting in a cardiology ward. It is a 12-week placement, but 2 weeks annual leave, so 10-week placement overall. The next question is, do you have sort of an idea as being a final nurse where you're going to specialize once you qualify? So if you've not already watched one of my videos, I did speak about the specialty, nursing specialty. So basically, I already landed a job waiting for me in A&E where I'm staying. I'm going to be working in A&E once I qualify. I chose A&E for obviously various personal reasons. I'll leave that video as well somewhere up here for you guys to go and watch. Basically, I applied for a job in my ending of my second year, going into my third year. I've already started applying for jobs. Some people say it may be too soon. Some people say, you know, yeah, that's basically what I did, because I just wanted to have that sort of motivation, you know, like when you have, you know, you feel like, oh, you've got a job waiting, so you're gonna start feeling more motivated to do things. I don't know, that's personally just for me, that's just the way I feel. So yeah, I've got a job waiting for me in A&E. I personally chose A&E, just like I said, for my personal reasons, and I applied for the job in my second year. So that's what I did. Next question is, where are your placements taking? Where are your placements? I'm guessing, where are your placements, like where are they located? Okay, so obviously me being a student from De Montfort University, obviously in Leicestershire, placements are around Leicestershire. However, I don't stay in Leicestershire, I stay in Northamptonshire, so it's two different counties. So before I used to travel up and down, but that was really tiring. For the last two placements, basically I've gotten myself accommodation, so I just got myself a studio flat for the 12-week period that I will be in Leicester. So basically that way I don't have to be traveling up and down. The accommodation where I got, which I'm going to show you guys when I vlog the whole place, is just about 20 minutes walk to the hospital, whereas if I had to travel back and forth, it would take me about 40 to 45 minutes just driving back and forth. And I think after 12-hour shift, that's the last thing you want to do, just traveling up and down, because it can be tiring. Not it can be, it is tiring. Okay, so yeah, that's what I'm doing. So this one says, can you give any advice for first year students? So first year nursing students, I have done a video before for any advice, any tips, you know, just my own personal experience. I've done a video on my first year, but this is my advice for first year. Don't break your back in regard to academic, because your first year's mark doesn't count towards your final year. Now, had I have known that, I think I've mentioned in that video as well, I would have probably not worked as hard as I did in first year, because second year was the hardest. So first year, just enjoy it, just take it easy. Obviously make sure you pass, don't fail just because it doesn't count, but yeah, take it a bit easy, and yeah, just enjoy it to the full that you can, really. Next question is, what was your best nursing experience? So my best nursing experience would be, let me see. So my best nursing experience would be the time when I had the opportunity to put in a catheter for one of the patients. I think it was really a daunting experience, but it was a very rewarding experience once I was able to get that catheter in, you know. So basically one of the nurses illustrated to us, obviously with the consent of the patient, how to put in a catheter, and then afterwards when I got the opportunity to do it and being able to get it, it was, you know, it was an experience. I think for everything that you do, I think it's a great learning opportunity, you know what I mean? Because this one asked if I can, due to the COVID-19, can you stay on campus or not? I personally don't stay on campus. Like I said before, I commute from one county to another county for my university. But I do have friends that stay on campus at this current point in time. I think it's a personal choice, honestly. I think some students prefer not to stay on campus because of this whole COVID, and other students decide to stay on campus. So yeah. Next question is, what is your worst experience in nursing? So my worst experience ever since I've done nursing was, it was two, but I think the first one, the other one, I could just handle it. I wasn't too bothered with it. But the second one was when a patient had a racist remark to say towards me. It wasn't a hard one. It was just a not nice one. You know what I mean? Like for me, certain comments I can ignore and just get on with it. I don't think it was hard as such. It was just not, it was just one of those things of, you know what, whatever, you do you, you know. And he made a racist remark, obviously asking if there's not any white people working here. He was asking me where I was from. Is there no white people working here? Why is he always seeing my face? I think that was the worst, because At that point in time, I just thought to myself, you know what, there's no need to be like this. You know, we are in the UK, and UK is a multicultural country, and you know, what is it all about, you know? So it was one of those things about you know, I wasn't too bothered. Like I said, I've got a video coming out on that one as well, about that nursing experience, but that was one of the worst placements. Yeah, I think actually I'm going to do a video on my worst things experienced on placements, as well as the best things I experienced on placement. I think that would be interesting to do. Next question is, hi Belinda, are you still doing a dual registration? So I have never done a dual registration before. I think what people are getting mixed up is when I made a video on transferring from adult mental health nursing to adult nursing. So basically I'm not doing mental health nursing and adult nursing together. I left mental health nursing to go over to adult nursing and be an adult nursing student. And once again, that was also for personal reasons. If you watch that video as well, you will get all the answers that you need at that current point in time. So the next question is, final year student, which year would you say was the hardest? I would definitely say that year 2 was the hardest. Year 1 was a breeze. Year 2 was like, year 2 was make or break, you know. And I think, you know, on top of dealing with this COVID situation, it didn't help at all. Year 2 was definitely the hardest year out of all the. Year 3 now, I'm being a final year nursing student. Basically, I'm practically finished almost, you know. I've got 4-5 months left before I'm finished, and yeah, that's it. Yeah, next question, as a final year, what is the level of academic as well as assignments? I don't know what you mean by what is the level of academics, but obviously you need to pass. Now with the assignment, I know that we have basically 3.5 assignments at least. So we have basically an assignment which was supposed to be a scene exam, but they turned it into a 3,000 word assignment. And then we've got a mathematics exam. It's an online one, and I believe we have to get 100% for that. And then we've got our dissertation, and then I've got 2 clinical placements, as well as a 1,500 word reflection on my management placement, about all the things that I've learned from year 1 going to year 3. So basically that's what I have going on for this year. So the next question is, are you going to be studying further after you finish? Definitely I'm going to be studying further. I don't really want to jinx it, but I'm planning to study 2 things. I'm either going to go into medicine, so I'm planning to take my UCAT exam this year, and if I'm not going into medicine, I'm going to do my advanced nurse practitioner. However, all of this is determined whether I'm going to stay in the UK or not. I will know by the end of this year if that's the case or not. But yes, I'm planning to do either one of the 2. Next, people want to know about how do you make time for your social life and holidays. So social life at this point in time is 0. Not because I don't have a social life, I choose not to have one, if that makes any sense. I don't know how I can say that. I don't really like to socialize with people. I know that sounds bad, especially going into the nursing field, but I like to be by myself. I'm happy to be in my own company, if that makes any sense. And like I said, most of the time when people go on for summer holidays, we don't really go. I never really had anything in the time I've been at uni saying, oh, I'm having summer holidays, because we either at uni or we are doing placements, you know, one of the 2. It's not really something that I could say we have summer holidays. Obviously we have holidays in between, you know, we get 2 weeks off in Christmas, 2 weeks off, I don't know, in Easter, something like that, another week off here and another week off there. But I can't really say we have like 2-3 months ago where we like, okay, yes, we're on summer holiday now. I haven't experienced that. I don't know how other universities work, but for me personally, my timetable doesn't say that. Okay, so the next question is whether do you need healthcare experience to get into university? I think I've made a video on this before on my channel. So this is the thing, I've always worked in care. Before I had a child care for about a few months, 6 months up to a year, almost, and then afterwards I switched over to adult care. So basically I've always had care experience behind my name, but I do have a video to show you guys how to get into university without the care experience, because truth of the matter is you don't always need care experience. It will be something nice and beneficial and towards your advantage to have it. However, you can still go into university without the necessary care experience. So the next question is, how are your shift patterns when on placement? So to be honest, it varies from placement to placement rather, because when I had my placement in a GP surgery, my hours was different. So I worked basically from 8:30 in the morning until 4:30 in the afternoon, 4 days a week. And we didn't have any weekend shifts. But the clinical placements, I did work a 12-hour shift. Also, once again, it depends from the hospital what time they start. Some start at 7, some start at 7:30. So I did a 12.5-hour shift. Mostly long days, although I did do a bit of nights, but mostly long days. I believe this is something that you have to work out with your mentor or academic assessor. Most learning outcomes are achieved in the day, so I would say that mostly my shifts that I've done so far are mostly day shifts. I did do nights, but overall I prefer days rather than nights, because I feel like with days there's things to do and time goes more quick. Like I said, it's 12.5 hours with half an hour break, half an hour in the morning, and then half an hour in the afternoon as well. So the next question is, what placements did I have? Okay, so being a third-year nursing student, I've had quite a number of placements, obviously. So in my first year, like I said, I had GP surgery, mental health, psychiatric ward, mental health hospital, and a nursing home. Then in year 2, I had surgical for my first placement, and then respiratory for my second placement. And now for my third year first placement, I'm going on to cardiology. So that's basically what I'm doing. My favorite placement, so I think I've said this before as well, my favorite placement so far has to be GP surgery. Guys, like, GP surgery is, you know, I think I said this before in my other video, if there was opportunity for me to go and work straight away as a newly qualified nurse in GP surgery, I'll definitely take it. I like the hours, I like the amount of patients that you see, you know, I like that, you know, it's closed up, you know, it's not really big like a ward or like a general hospital rather. Obviously there is a stress, but it's a different level of stress compared to hospitals or wards, if you know what I'm saying. So GP surgery has to be my favorite placement of all times, honestly. The last question is, do I work? And the answer to that question is yes, I do work. I think I have mentioned this before, how I generate my income while being a full-time nursing student. I do work. I am a senior support worker in a residential care home. So yeah, that's basically what I am doing. So it will include things like medication, administering medication, writing referrals, calling GPs, booking appointments for the residents in a care home. Basically, those are all things. Booking in medication, booking new stock of medication, doing stock check, counter medication. So it requires quite a lot, and that's also another way that I get my experience from as well, working there as a nursing student. So that's quite a good experience for me. So yeah guys, these are the questions that I've been asked. I hope this video has not been too long. If you've got any more questions, ask them down below. I'll be more than happy to answer them. And yeah, so this brings me to the end of my video guys. I really hope you like it. Please don't forget to comment, like and subscribe, and I will hopefully see you guys in my next video. Bye.